Good afternoon, good morning, everybody. My name is Earl Hanley. I'm an application specialist with NextGen. And Wendy and team have asked me to provide a high-level overview of our ability to connect into the fax service manager and then pull down those inbound faxes and direct those directly over into document management. So you're not printing paper, you're not having to manage fax machines and so forth. Some of you may already have this workflow already configured within your organization. Some of you may not, where you're still spending money on paper coming out of fax machines and so forth. So this is just an opportunity for us to show you how we can actually configure NextGen to process electronic faxes directly into document management, where they can be managed from that perspective and then routed to the appropriate resources within your organization. So let's go ahead and get started. So I always like to start off just talking a little bit about security. If your goal is to receive inbound faxes from eFax, I want to be able to then route those into a folder or into a batch in document management, but I have to have the appropriate security for doing so. So just from a foundational perspective, you have to ensure your rights are established for faxing, as well as document management. So do you have the ability to delete pages that come through document management? Because it's that end user that's going to be interacting with those batches that are going to be created as a result of inbound faxing. So again, you just need to make sure that your security is established appropriately. Now, you have to have the fax service manager installed, which you more than likely do. But once it's installed and once you're connected to eFax, or maybe you're connected to another fax service provider, it allows you to configure the fax service manager to do a few different things. First and foremost, you do have the ability to connect, for example, to your fax service provider. In this instance, it's eFax. So I can go ahead and identify the inbound dialing number or faxing number has been enabled. I can go ahead and enter my username and password to ensure I have a connection with eFax and so forth. So again, it just allows you those standard types of configurations from the fax service manager perspective. Now, if you want to receive any notifications if there's any failures, just so you know, you can also establish an individual or an administrator to be notified if there's any fax failures, focusing on those outbound faxes. So there's utilities on the fax service manager that are also available for those outbound faxes that the system's going to generate within your organization. So again, a configuration that does exist within the fax service manager. So those are the outbound faxes. And this is just giving you a view of the panel within the fax service manager, the outbound fax statuses, such as what's been sent, what's pending, or failed. So again, it gives you that visibility. Now, this isn't a server that's available that the standard individuals can review. This is really somebody from that technical background that would be managing the fax service manager, and therefore also probably being notified that there are failures with faxes that are going out from clinical workflow or documentation in the system. So again, this is just giving you that visibility as to those outbound faxes and their statuses. Now, we have the ability to use the fax service manager to also create a workflow for inbound faxes. And what do you want to do with those inbound faxes? So really, this is the preface of this conversation on how we want to look at how can we automate those faxes that are coming inbound into NextGen. Rather than printing out on a fax machine, we can actually route those to document management so they can be managed appropriately. So let's take a look at some of the configurations that are required. The very first configuration is going to be in universal preferences, where I have to create a fax queue path. Where are those faxes going to end up at once I receive those into the system? It's a mapping rule that we have to establish and apply to the fax service manager. So again, just where is that folder, network folder, going to reside? Then in our fax service manager, we have the ability to configure working folders, and then allowing us to connect to that working folder, that directory that we created in enterprise preferences. Where do we want these faxes to end up at? And basically, we're going to look at the NextGen root folder and a fax queue folder. So again, allowing us to again take those electronic faxes and route those to a specific folder so they can be picked up and processed over into document management. This configuration also requires an ODBC connection as well. So again, it's just something that will be established. And if you need any assistance with this, our support department can help you out. Just log a ticket. Now we do
Hey,
have,
Earl, hey, Earl, one question while you're kind of here before we move on. We have someone said that they're hosted. Can they get access to the fax service manager?
they would
Do you
be
know
able
the
to have
answer?
access. Yes, you should be able to access the fax service manager, even if you're hosted, correct? As
Yeah,
long
I
as
thought so. Just
you're,
wanted to clarify. Thank you.
you're welcome. All right, the next component of this is the inbound fax setup. We already have our network folder, that's the fax queue folder established. And then we have inbound. So it's focusing on those inbound faxes. And you also have the ability to add the port to the path as well. And this is really going to be dynamic because when we send faxes into this workflow, we can actually create folders by that telephone number that's being received, or that fax number being received into NextGen. So again, there's a configuration that the system will automatically promote based on this setup, which makes it really kind of easy for you as an organization to manage these inbound faxes and where these inbound faxes are being directed to. You might just have one fax number, or you might have 4 or 5 fax numbers within your clinic even. So again, it allows you to manage how these faxes are being processed. I had one clinic that had a fax number, it's multi-specialty, so they had their own fax number based on specialty. So they wanted their own unique folders of electronic faxes created by specialty. So again, it allows you that type of configuration. But once we do our inbound fax setup, then after that's all been established, I want to go into the background business processor, because I want the background business processor to automate the pulling of those inbound faxes from that fax folder into document management. I don't want my end users having to do this. So you can create a job called fax auto import. You can establish certain parameters like you can for any type of job within the background business processor. I can establish a schedule. So maybe you want to have this run every 15 minutes to see if there's any new faxes in that inbound fax folder. So you want it to actually sniff for documents that are sitting there so they can be pulled over into document management. Maybe you want it every 5 minutes. So again, it really allows you the flexibility to establish when you want the system to auto run to pull documents in from that fax queue folder into the document management platform. So again, this is configured by you. You also have the ability to set up user confirmation when an import's complete. Now, if you're running it every 5 minutes, I don't think you'd want to set this up. But if you run it once a day, then maybe an individual would be contacted when that import process is complete. So again, giving you that capability to set those types of rules up within the background business processor. So once we have that established, then we can put all the bits and pieces together. And just so you know, when we set up inbound faxing to process documents electronically over to document management, there's some setup and some testing that we'll actually promote. So when eFax, for example, sends a fax into the system, they'll actually send a test fax in. And when that test fax is received through the different folders that we've created, it will create within that fax queue folder under inbound, it will create a folder based on that phone number where that fax was received from. So if you have multiple fax numbers within your organization, then just by sending a test message through the eFax into NextGen, I'll actually create these unique folders where those faxes will go into by fax number. If you only have one, then it would be just the one folder. But this is just a testing protocol that we can enable within the system if you're going to approach sending those faxes electronically over to document management. So again, this is one of the setups under the inbound fax folder. We can actually create those folders by fax number through this testing protocol within the system. Now, under master files in NextGen, under document management, we do have a protocol where we can create storage locations. So I can go ahead and look at my master file storage locations, and I can actually create a storage location by a provider's name if they have a unique fax number, by labs, or by behavioral health, or primary care. Again, depending on what types of fax numbers you have running in and out of your organization, you can create a storage location for those. And that's going to also assist us in creating that batch file that will be available within document management. So again, we could have, for example, if you're multi-practice, I could have a storage location dedicated to Dr. Barclay. I could have a storage location dedicated for faxes by lab, podiatry. But look at, look at what's in common here, the phone numbers. So those are your fax numbers that we've already established that through our testing, they're going to be mapped into the system automatically. But now we can give it a human name or a location name to that storage location. So again, giving you that flexibility. Also under practice B, I can have a different configuration for another practice. So again, this is allowing you to identify, to make it easier for your individuals in document management to manage these types of faxes. Now under storage location, under practice, under master files and document management, in the storage location configuration, this is where you can name the storage location. So inbound fax for labs, either by the telephone number. And so again, we map that to that folder that was created by that test. When we ran those faxes into the system, there we can see that fax number that was created with that document into it, that was placed into it. So this allows us to create those different storage locations, one for lab, one for Dr. Mark. You can also create logic on the storage location. When a document hits that storage location, we can actually default a batch name. So here we have the batch name. That's what I would actually see in document management for Dr. Mark and all those faxes. And I can also create logic that says create new document per file. So I will, instead of just sending, okay, here's one file in document management for all faxes for Dr. Mark, I'm going to create a file for every fax received into the system under one transmission for Dr. Mark. So again, I don't have to dig through multiple fax documents in the system. The system will actually create a different folder if one fax is coming from Dr. Marcus, one fax is coming from United Healthcare. Again, it allows me to create a different folder for Dr. Mark, so I can just focus on the content within that fax. So again, it sorts all the data in the folders for the individuals for document management. So again, it gives me that ability, max documents per batch, 1, 2, 3, or 4. So again, giving you that flexibility in the configuration here as well. But this is really allowing you to come into the storage locations and file maintenance to put a human name against that fax that's received into the system, so your folks in document management can manage those faxes appropriately. And then, of course, you link it to those folders that are created from those inbound faxes and their numbers. So again, I have the ability now to turn on the background business processor. I'll enable those rules within the system. And this is what the results would look like. So if I had just one fax number, I would just see one batch per transaction in the system uploaded into document management. If I have multiple fax numbers and I have them named appropriately based on storage location, I can see that they're broken out based on those different fax numbers. So if I'm responsible for just managing faxes for Dr. Mark, I would use Dr. Mark's folders, open up those faxes, route those into the appropriate patient's charts. Here's internal medicine. So I might be responsible for all faxes for internal medicine, labs, Dr. Barkley, and so on. So you have the tools to configure how you want to receive these within your system. So in summary, in NextGen, Fax Manager pulls faxes in for example, every 60 seconds. So if it's eFax, we're always going to be querying for faxes to come into the system. We can download those faxes into the NextGen inbound fax queue. Those folders will be created by fax number. So as long as eFax or your fax service provider have those numbers established, we'll create those folders automatically when we run those tests. And then the background business processor is going to take those documents sitting in that fax queue folder and then upload it into document management following the rules created based on those naming conventions and those mappings that we established in the storage locations and master files. And then, of course, when that transaction is completed, then we'll automatically send an email that the job is completed through the BBP, if that's something you want to turn on. But keep in mind, when you set up your jobs in the BBP, you can have that run automatically every 5 minutes, 10 minutes, 15 minutes. So again, it's a configuration that you can support.
So there is a question about the BBP, Earl. Would running that batch every 15 minutes cause any system latency issues? Okay, no, I didn't think so. Yeah, thank you. I
have my demo system. Actually, I'm connected to our support desk, and I have mine running every 5 minutes to populate into my demo system. So with that being said, this is just a little diorama. I'm going to send a PDF of this presentation to Wendy so you can kind of look at it. And if this is something that you want to implement within your organization, you can certainly do that. But this is just giving you an example of everything that we just discussed. Here's eFax. It's an API, the information sent to the NextGen Fax Service Manager. By the push, we create these storage locations by fax number and the fax queue. And then the BBP auto imports it. And then, of course, we create the different batches in document management. And just to give you a view of what that would look like in my demo system, I actually have that running. Go ahead and move this out of the way. This is the fax service manager that I showed you in the PowerPoint presentation. Of course, all of you have this if you're faxing out of NextGen. But this is where you would come in under the configuration. This is where I identified the working folder that I've created in enterprise practice for enterprise, the enterprise configuration. This is where I mapped that folder in that NextGen root for eFax and fax query. That's where I can find that information or do that mapping directly through here. And under configuration, under the inbound fax setup, again, it's allowing me then to point directly to that fax queue inbound folder that's established under the NextGen root. So again, this is just technical mapping. This will be, you can certainly receive some help with this, but again, it gives you that flexibility here to create that initial mapping protocol. Bear with me. Actually on two servers here. Under file maintenance, this is where I can establish the storage locations. And so in my demo system, I only have one, but if you had multiples, you can create multiple storage locations. And when I open up the storage location, I can name the storage location. Here's where I can find the file storage and see the fax number that was created by processing that initial fax into the system. So we can automatically pick it up. And you can map the storage location to the NextGen root folder, and then identifying that storage location by name and pulling that into this configuration. And this is where you also can name your batch. You can name it whatever you want to. You can create a new document per file. So again, if I get one fax in at 801, one fax in at 802, it's going to create two batches in document management. Or it can put all faxes into one folder or one batch in document management, and your document management folks can manage that appropriately and route those within the system. So this is the storage location, master file storage, and this is where we map everything together. When it's all said and done with, this would be the results. So here I can see I have a batch and we number the batches. It's an inbound fax, and this is your customized naming convention. It was an auto import through the BBP, and I can see there's one document and I can see it was created at this specific time based on the configurations of your storage location. And then if I wanted to look at what was inside, I could just double tap on that. Here's the fax that was presented. I just have an RX cover here. So at this point in time, if I want to go ahead and map this to the appropriate patient and the appropriate document type, I can pick this up and just route it directly into the patient's chart. The things that you're currently doing today, if right now you're using the scan function to get these documents, into the patient's chart. So based on the configurations, the end result is to process your faxes into document management as a batch based on your fax number and based on your naming conventions, so you can organize the information for your document management folks that are responsible for managing those documents. So that being said, that was just a real high-level overview on how we can map inbound faxes from eFax or another fax service provider directly into document management, using certain protocols that we can set up in the system to, again, the end result is creating that efficiency for your end users to interact with those electronic faxes versus that additional step of, printing paper and then having to scan it directly into the system so it can be mapped into the patient's chart. This automates that whole entire process for you. So Wendy, at this point in time, I'll just open it up to any questions. Oh, and one final note, the PowerPoint presentation I created, I might have said this already, I'll create a PDF and send it to Wendy, and then we can make that available for you as well.
Absolutely. Absolutely. Thank you, Earl. I'm not seeing any more questions, but we'll pause for a moment and see if anyone has any more questions. And again, we'll put the recording of this presentation on the link in Success Community, as well as we will post, we will get someone from the marketing team to send out the actual PDF to those who are registered for this session. So you can have a copy of this deck that he's using. Okay, let's see. I think a question just came in. Did I hear you say that incoming faxes can be routed according to the number the fax is coming from?
Correct. So what we'll do is when we set up the configuration, like, for example, eFax can send us a test fax. And when that fax is received into NextGen, we'll actually create a storage location for those faxes to be received from that specific number. And then we'll create the storage location in file maintenance mapped to that fax number. Therefore, the end result would look like this. My system is just uni. The end result would look like this. So if you have multiple fax lines that support your clinic, then based on that folder that I got to move this box here. Those folders I created based on those fax numbers, I can create these different batches that are anchored to those fax number folders. So when they're received, this is how I can communicate that information back. So if you have multiple fax lines coming into your organization and you want 4 of those fax numbers to create an electronic document that can be managed, document management, those folders will automatically be created by fax number in the storage location that we can map to, or the inbound fax queue that we can map the storage location to create this nomenclature in image batches and document management.
And there's a question, do you have recommendations for inbound failed faxes to send notifications?
Inbound failed faxes, the only one I can ask, the only one I know is if the only kind of notification I can identify is if the background business processor did not process successfully. I can send a notification that way, but if the inbound fax, I'll have to ask my support individual. I don't know if the fax failed coming inbound. I don't know if yeah, I'll do some research and get that information back to Wendy.
Okay. And there was also a question earlier about outbound fax workflow. I don't know if there's something different to say about that.
For using faxing in NextGen, not really. The faxes will go directly out to the fax service manager, and then whoever your fax service provider is connected to fax service manager, and if it was eFax, we would automatically process those out of NextGen. The only different the features that we can support internally for the end user. Get back into the EHR here. Is that we do have under view, we do have a fax status work queue where I can do a search, and I would have the ability to identify if there's any faxes that I'm sending out through my standardized protocols within the EHR. So I can see what failed, what was sent, and so forth, and then I have the ability to actually manage this or resend it from this perspective as well. This wouldn't require the users to be on the fax service manager. It would create the same type of log on the fax service manager, but you would want your users out there kind of looking at that. That would be somebody, like somebody asked earlier, can I get access to that fax service manager if I'm hosted? So this is a tool that the end user can view, but it's going to follow the same faxing routes. If you use automated document sharing, and I initiate that it's a fax rule, it's going to be picked up when that document is signed, and it's going to be sent out automatically as a byproduct of the patient's chart note created. It's going to be sent out via the fax service manager to your fax service provider to be delivered to the recipient or the referring provider. So it's going to follow those same rules and guidelines, but you do have visibility here with under view fax status to see if faxes are being processed correctly or if there's any failure in those faxes. So again, we do have this capability in the system.
Okay, a couple of more questions. Does it create a batch every time it imports a new group of faxes, or are the batches by fax number and added to every time it refreshes?
It's depending on how you want to configure it. So again, I can create a new document, a new batch when I receive a fax. So the logic here applies that, do I want to keep everything? Do I want to keep everything, if I have fax numbers here, do I want to have everything in the folder associated to that one specific fax for that one specific fax reason? Now, you might receive a fax from a specific entity that has multiple patients inside that one fax. Fine, you can go ahead and use the document management tools to actually refile different documents for the patient and so forth. But if another provider's office or the insurance company or somebody's faxing you some documents specifically for a patient, we can actually house all of those documents into one folder, depending again how you want to set this up. So it's really a configuration option for your organization. Do you want one folder that receives all faxes into it, and then I just go into that folder and I just manage them when I get into the folder and route the documents? Or do I want to create a work queue that kind of focuses on the organization of documents by patient and by phone number? So again, it's just a configuration that you can define within how you want to use the tool. What works best for you?
Yeah, sorry, a couple more questions. We have someone here who just uses NextGen PM. Do they need EHR to utilize this function?
They need document management to utilize this function for inbound faxes.
Okay.
So you'd have to have the fax service manager, and then just no EHR.
Yeah, that may be a question you want to pose to your account manager and see if they could get
that too, because I don't know I wouldn't know your setup and your configuration in the back end. A lot of documents that come into document management have to be routed to a document type. And the document type then creates a category that's associated to a category. And those categories are displayed in the EHR. So I would just have to we would have to verify it, or your account manager can verify that question for you, depending on your.
Is there a way to view images of sent faxes in NextGen, or do we have to log in to the eFax to see them?
I have a PHI log that I store all sharing of information. That's a good question. I'll have to do a follow-up on that.
Okay. And for outgoing faxes, is there a way to store the outgoing fax in the patient's chart?
We don't actually keep the fax in the patient's chart, but we have a couple different audit utilities that a fax was sent. For example, we have Express Engine history. This gives you the ability to look at your fax queue. This allows you to see everything that was sent out from this component. So we can capture, I believe this populates if you use Express Engine or if you don't. It gives you that capability, but we also have PHI log that we store. So I have the ability to pull up a specific physician or a specific transaction. You can see I have some here already, where I can actually come under edit, and then I can see exactly if any document was sent out and then what was delivered. But I don't have, I don't keep an image of all the documents that were faxed within this type of history, unless you created the documentation and then sent that out based on custom print and send. Those would be documents that are coming from your counter, so they already exist here. So I do have the audit that what was sent out and what was shared. I don't think we can recall the image though, however. Unless you put a phone note, say you fax it on this date that there was some information here you want to enter into your encounter. You can certainly do that, but we do keep the audit logs.
And so there was a question about, can we save the cover sheet and record of transmission to the patient's chart? And then they said clarification. Well, it just flipped out on me on it. Clarification. My questions keep flipping because people are asking more and more questions. Can the record of the outgoing fax be saved to the patient chart? I guess they just want to have a copy.
Yeah, we don't have the ability to inherently save a record of what was sent, because if I come under, how are you faxing today, but under custom print and send, if I came over to fax, I can go ahead and select my documents that I want to fax out. And then from there, it allows me to connect into the provider, and I can create my own cover letter or cover sheet. And then by faxing this information out, it's going to create a PHI log transaction in the system to communicate what was sent out. But it's not going to create a document that shows what was sent.
Is the PHI information created automatically, the PHI log?
It is.
Yes, okay. There are some other questions in there, Earl. I don't know if you have time to read through them. Let's see. Again, there's some questions about hosted clients. We highly recommend the office have another private fax so that if they need something urgently from another provider or individual, they can give that fax number instead. They don't want to wait for a half-hour queue. So I guess that's kind of the queues. Instead of having to wait, maybe have a separate private fax number. That's not a bad thought there.
Right. Or you can have a fax number dedicated to that and not map it to document management, so it would just spit out the fax. So again,
just spit out the fax, yeah.
For that.
There was a time frame listed on the example. Would the report catch those that came in after that time frame?
For the background business processor processing?
I saw on the example there was a time frame listed. Would the report catch those that came in after that time frame?
Well, the time for I'm thinking it would be the background business processor, where we can establish when we import. So you establish the importing parameters. If your imports stop at 5 p.m. and then move to the next day to 7 a.m., then they would just be picked up at 7 a.m. the next day. I'm guessing. I'm thinking the time frame. What other area that we discussed time frame?
Okay. And Earl, is there an added cost to use this service?
From what I just demonstrated today, no, that's a configuration in NextGen.
Okay, I thought so. Okay.
As long as you own document management, or it's your license for document management, then it's just an inherent configuration within NextGen.
Okay. Well, we're a little over time, but these have been awesome questions. Great presentation, Earl. Thank you so much. Thank you, everyone, for your participation. And again, if you want to grab the link there to Success Community, it's there. But if you just go to Success Community, type in Lunch and Learn, you'll see all the series, you'll see all the recordings. It'll take us a couple of days to get this recording out there, and we will also make sure you get the PDF. So again, thanks everyone for your time today, and everyone have a safe and happy afternoon.
Thank you, everybody. Have a great day.